ಕಾಲೇಜ್ ಇದೆಯಲ್ಲ ಸರ್, ಅಲ್ಲಿ ಸ್ಟೂಡೆಂಟ್ಸ್ ನಾವು ಫಾರ್ಮಸಿ ಓದ್ತಾ ಇದ್ದೀವಿ. ಸೊ ನಾವು ಕೆಲವೊಂದು ಟಾಪಿಕ್ಸ್ ಮೇಲೆ ನಿಮ್ಮ ಹತ್ರ ಕಾನ್ವರ್ಸೇಷನ್ ಮಾಡಿ ಅದನ್ನು ಶೂಟ್ ಮಾಡಿ ತುಂಬ ಜನಕ್ಕೆ ರೀಚ್ ಆಗುವಂಥ ಪ್ರಯತ್ನ ನಮ್ಮದು. ಅಲ್ಝೈಮರ್ಸ್ ಡಿಸೀಸ್ ಬಗ್ಗೆ ನಾವೀಗ ವಿಡಿಯೋ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಸರ್. ಸೊ ನಿಮ್ಮ ಹೆಸರು ಏನು ಅಂತ ನೀವು ಪರಿಚಯ ಮಾಡ್ಕೊಡ್ಬೋದಾ ಒಂದ್ಸತಿ ಆಡಿಯನ್ಸ್?
BS Ramachandra Rao ಅಂತ.
BS Ramachandra Rao ಅಂತ. ಹಾಂ ಸರ್. ವೃತ್ತಿಯಲ್ಲಿ ಪ್ರೊಫೆಷನ್ ಸರ್?
ನಾನು ಟೀಚರ್. I'm a teacher.
You are a teacher, sir. Okay. What did you teach, sir? What subject?
I was in intermediate college. ಅಲ್ಲಿ ಇಂಗ್ಲೀಷ್ ಹೇಳ್ತಾ ಇದ್ದೆ.
ಇಂಗ್ಲೀಷ್ ಆಗಿ.
ಈಗ ರಜಾ ಆಗಿದೆ ಕಾಲೇಜಿಗೆ, ಅದಕ್ಕೋಸ್ಕರ ಮೈಸೂರು ಬಂದಿದ್ದೀನಿ.
ಹೌದಾ?
This is my father, BS Ramachandra Rao. He is an engineer. I am also an engineer. So he is also retired and I am also retired. He started with mild cognitive dementia about 3 years back, and now I think he is having a moderate, he's in the moderate stage. When we first got a sense of what all was happening, see, till 2010, 2011, we had no idea because my father was perfectly alright and he was making up for the lapses of my mother. So she wasn't able to cook something. He used to, and he was also well retired by the time. So he used to be with her in the kitchen and he used to help her out in everything. It's only in 2011, I think, when he had a fall and he broke his, my father had a fall.
Okay.
So he broke his pelvic girdle. At that time, since he couldn't move around for quite some time, and then we realized the seriousness of my mother's situation. She wasn't able to do anything alone. So my father and mother. Right.
Yes, sir.
Father and mother.
Yes, just a minute, sir.
This is the drawing room or hall where my mother used to sit. She used to sit here, and my father also. My mother passed away last month, August 7th. You know about that. So, and during the course of the onset of the disease, we used to engage them with some games or memory stimulators, as I want to call them. So, since my father is an engineer, he likes to prepare these engineering models.
Oh, wow.
And then, okay. This was in the better days. Earlier, he used to play Sudoku, and now he cannot. And then mixing and matching. It's almost like a Montessori class.
Yes.
Right, so you have all these pieces in the puzzle.
Yeah.
So the puzzles that we arranged. And then this is a reminder of my mother's embroidery days. And we used to remind her with the help of these appurtenances. Photograph of my father being honored by Rotary Mysuru. My father was a freedom fighter. So yes, he participated in the Quit India movement as well as in 1946, and he also participated in the Karnataka state Charwali in 1950. So he was honored along with the MP Pratap Simha. Moving on. These were the toys which we used to engage my mother. We have balls here. She was a very good tennis player. So you can see the tennis ring there. And then
What do they get?
This is sort of a laser pen which we used to show it on the walls, and my mother used to catch hold of the patterns. Right, so we used to put it on the table also. We used to show the laser on the table also. So in the table, they used to come a pattern. She used to catch hold of the pattern, thinking that it's real. It was sort of a memory stimulator. And then of course the regular torches and balls and other things. We used to jog her memory with the help of these albums. They were in better shape. My mother used to tear them apart. So the albums are gone now, and we only have the photos stuck on the notebooks. Moving on. Yeah. Also, in the good old days, I also used to put labels. So these are albums, and this is stationery, just to help them. But that was, of course, long back. Work on some beaded items. So she used to prepare the dolls.
These are the creations of man.
Yeah.
Ma'am did this one, sir.
Yes. All these beads.
So even after she developed this condition, she was able to read these things?
No.
No, she
Once
wasn't.
she developed the condition, we used to remind her that she used to do these things. Hasta mudras,
Yes, sir.
or hand mudras. There's 6 of them. They are called as hasta mudras, which are supposed to be good for health. This is, of course, a brief biography of my father as a freedom fighter. ಮಾಡ್ತೀರಾ ಮಾಡಲ್ವಾ ಫೋಟೋ ತಗೊಂಡಂಗೆ ಮಾಡ್ತೀರಾ ಸರಿ and long back he used to actually he's supposed to be an expert. He had created this forecasting sheet, prognostic sheet.
Yes. With the help of which he will be able to predict what's going to happen tomorrow for you, and he will be able to predict your future. Wow.
Yes, he was doing that earlier, and people used to come from far and wide to take advice from him and suggestions from him. Now I really can't vouch for the correctness of the procedure, but he used to pass his time like that.
Okay.
This is my parents' bedroom. So my father sleeps here, my mother used to sleep here, and of course these are all the additional clothes that they need to wear. They already lost the control of the bladder, not just the bladder but also the
Double.
yes, the bowel also.
Yes.
So we got some medicines and other things here. And now there, this is my father's toilet. In order to avoid confusion with my mother, so we put up labels there. So now only my father will go inside. My mother, when she was alive, she didn't go there because she used to read it. Same here.
Yes.
Same here with the bathroom. My father's bathroom, and this is my mother's toilet.
So the names were written for them.
Yes, yes. See, because this is an Indian style toilet, and that's a Western style toilet. So if my father goes here, he will not be able to get up.
They were able to figure out about personal hygiene.
That was earlier.
Earlier.
Earlier. All this became waste.
Once they
Once they
into a serious
started
stage.
forgetting everything.
Okay.
This was when they were sort of
Were
halfway
they
through.
able to read the labels and all at the severe stage, sir? The reading functions were all right?
See, my mother So it has been suffering since the last 10 years.
Okay.
So out of that, the first 3-4 years, as you said, the reading functions were all right.
All right.
And she was able to remember certain things.
Mm-hmm.
And she used to sort of imagine certain other things and all that. But when it came to, after that, the next 2-3 years, he started forgetting more things, and she started arguing and fighting with the caregivers also. And then the last 2-3 years, she has been very silent because she just did not know who she was.
Okay.
That's what we thought anyway.
Yeah.
So this is a list which I pasted here so that they can remember what to do and what are the good things to do. This is a book written by my father in Kannada, Sharanagati Mattu Nantara. This was written in 2015, 7 years back. Okay, so which means at that time he was good enough to write this book. I think his problem started a couple of years later, maybe 2017 or 2018 or so. And this is about my mother again. This, as I told you, she was doing embroidery. So, in one class you only teach one
type.
and then the other classes.
Okay, sir.
My mom and I, we did our studies together in 1979, right? So I completed my engineering in 1981, and she completed a Master of Arts in English in 1979. So which means we were both going, yeah. So at least for 2 years we were going together.
Oh, that's
She was getting down at Gangotri and I used to go to SJC.
Yes.
Because I don't know how relevant this is. This is all about my father and his good things.
Achievements.
Yes, in the good old days. We already,
Yes, sir.
right. This year we take. So, as a freedom fighter, he got a number of awards at that time. Both from the state government and from the district administration. He was in the middle of writing another book. Now, he has written this. Now, somehow, because they are in bits and pieces, I have to synchronize them and make them into a readable book. It's very tough. But I'm on it, and I hope I'll be able to complete a book out of it. And then we took her to, because they are ardent followers of Satya Sai. It's a very good institution. Satya Sai Institute of Higher Sciences, Higher Medical Sciences, Medical College cum hospital. And there she was declared mild cognitive disturbance. She already had hypertension at that time.
okay.
And she was given some medications like Rivastin, Rivamar, Rivadam and Exelon. So they were given for quite some time, just a couple of years. All her other parameters were quite okay.
Okay.
She didn't have sugar, diabetes. All the other parameters were okay. Then around. So here my father says that we are giving her the medication. Initially she showed marked improvement, but now with one injection a month her memory has again deteriorated. She is also taking Revamar 1.5 mg twice daily for the first 2 weeks, and NWAS. She does some physiotherapy exercise regularly and is keeping good health. And this is how it was at the initial stages. And of course, we showed her in neurology departments in Mysuru, so Dr. Bhaskar and others. But as you know, there is no improvement. I don't think there's any improvement for anybody in this particular disease. And so once things started, so I just used to keep a checklist here. You can just take a copy of the checklist. The checklist says, so if she gets any external wounds, you apply boring powder or Dettol and so on. And for improving her blood, since we are not doctors, so we used to write down all the important things. So if she had a headache, give her crocin. And there was a lot of acidity in terms of gastric digestion. Our family has digestion issues. So she was given Pentawalk first thing in the morning and then later on. Yes. We're able to. And motion was a big problem. She was not passing motion on a regular basis. We pass motion maybe first thing in the morning, at least once a day. In her case, she wasn't able to do that voluntary action. So she wasn't passing motion for a couple of days, 2 days, 3 days, 4 days. So we used to have some of these supplementaries like honey and Prudac and Laxopeg, Kayam Churna, virgin coconut oil, Duflac, Dulcoflex. So not all of them at the same time, but depending on what the doctor suggests. So that she, in spite of which we had to admit her to Vanami Hospital a couple of times, just because she didn't pass the motion for a week or 15 days.
She wouldn't recognize the instinct to go to washroom.
That's right.
Otherwise, she'd do it on anywhere or.
Would she do it
Of
on
course,
the bed
no.
or
I mean,
something?
by
Is
this
she
time
constipated or she?
By this time she was on
Normal. Okay.
diet.
The food intake and all was normal, sir? The
Food intake was gradually reducing.
reducing.
So, to keep her calm. So what happens was in the evening or in the night, she used to get up and
Leave the house.
wanted to go out or wanted to go to Bangalore in the middle of the night and things like that.
Okay.
So there were some medications suggested by the doctors: Zolfresh, Triptomar, Spenzo, Miltas. And then we always used to give her supplements like Becosules, Zevit for zinc, and in case she had any infection, some antibiotics. And a couple of times she passed black blood,
Okay.
either through vomiting or through the intestinal bleeding. So black blood would mean that the bleeding has taken a
Intermittent.
few days back.
Yes, right.
So, which is hazardous. So, she was admitted for that also a couple of times. But after that, we started giving her sucrafil, honey, ice cream, curds,
Yeah.
virgin coconut oil, mucane gel, and so on. Otherwise, we used to give her gulkan, ashwagandha, chyawanprash,
Right.
fruit juice, curds, ganji.
Okay.
And for dehydration, because she wouldn't know that she is thirsty or not, so she would never ask for water. So at frequent intervals of time, we need to give her Yelniru or ORS or just water.
She was regular on her medications.
Like she used to accept
Yeah,
the
we
medications.
were
or she
regular on
used to-
That's
her
why they
medication.
had a caregiver.
She used to reject the medications or what, sir? Like,
Not really.
not really. Because some people-
Sometimes, if the pills were too big, she just used to spit them.
No, some people they'll swallow the medicine in front of the caretakers or somewhat. If they like slowly
Leave
they'll
the
spit out.
premises.
Like that all.
By this time, she had already forgotten how to dupe.
Oh.
So.
Okay, right.
So
Even that was-
yes, if the pills was too big or the capsule was too big, sometimes she used to spit it. But that is not behind, right in front of you, at your face. Good afternoon, friends. I am Arun, and I would like to share my experiences that I had with my parents, who were both suffering from dementia. My mother, I think, got it in 2010 or around, and she passed away last month. And my father has had it for the last 3 to 4 years. So, let me start. My mother was a strong lady all the time, and she, even when my father was abroad, she took the risk and she had the courage to conduct an eye operation for me at the age of 3. And 10 years back she was diagnosed with mild memory loss. She had short-term memory loss. She used to forget things which had happened just now or just today, but she used to remember what happened earlier. And she used to forget the routines slowly, one by one. She used to forget the step-by-step routines. For example, she used to forget that she had to wash her teeth or take bath, or she had to cook the breakfast, prepare the breakfast, or prepare the meals, and so on. But she used to write well and read well. In fact, we did our graduation and post-graduation studies together. I and my mother, we did them together. It was in 1978. She got her MA in English at the age of 45, and I was also going for my engineering studies. So we used to go in the same bus, and she used to get down at Gangotri, and I used to go along and get down at JC. So she had a lot of guts, and she wanted to do and achieve a lot of things, which probably she achieved as well. This is her original handwriting. You can see that it's fairly decent handwriting in Kannada. So what happens is, if I have to discuss her behavior or the behavior, since now I have 2 patients, her behavior and my father's behavior. So the patient reflects his original self, which means to say that there is no mask. Now the patient has removed the mask, so he or she will not be worried whether they're properly dressed for the occasion or whether she is talking properly. So whatever is there in the mind, it comes out. Similarly, the patient becomes a child. And since the memory started fading away, it was replaced with some fake memory or false memory, and also there used to be some hallucinations. Even now my father has hallucinations in the middle of the night. He says, I have to go to court. Now he has got nothing to do with the court. He is an engineer, but his father was a lawyer, and his father used to go to court every day in Tonga. So I have an important case to fight and I have to go to court, and please take me there, and why are you not taking me there, and so on. Or hallucinations like somebody is hitting me or somebody is biting me, or so on and so forth. And my father doesn't have any stress or depression, but my mother used to have stress and depression, again mostly due to forgetfulness. She used to ask what the time is, and then she was told once, twice, thrice, four times. And 5th time again she used to ask what the time is. And then when you don't repeat the time, then she used to say, oh no, you don't care for me, you don't even tell me the time of the day. So, and then she started wandering. When I say wandering, that was probably in the initial stages. She used to open the door and go. We didn't have a nurse at that time. So one fine day, we searched her all over the road, this side, that side, And finally, after half an hour, we found her standing on the balcony of the neighbor's house. And the balcony didn't even have a railing at that time. So she was standing there. Nobody thought of ever looking for her there. One person went to the railway station, one person went this side. It happened a couple of times, so we used to have a sort of identification mark on her hand. So, as I have shown you the photos, we put up on the walls and doors certain instructions which they had to follow because they used she used to keep forgetting. And by this time we had nurses, and she used to argue with the nurses. Suddenly she doesn't know who you are. So they said, what are you doing in my house and why are you holding me? You want me to take bath, so I'll take bath. Why are you here?
She gets defensive.
Right. So, and she used to be a bit aggressive, and the nurses also, depending on it all depends on the empathetic nature of the nurses. So if the nurses show empathy, it was fine. And otherwise the nurses also used to argue and quarrel, and they used to hit one another, and my mother used to fall down. She had a gash on the head, which was taken to the hospital and so on. And like I said, she used to walk off unannounced to nowhere in particular, unable to comprehend while watching TV. Earlier she used to watch TV, but then slowly because the TV is very confusing, you have one stanza going here left to right, and then you have another stanza at the bottom fixed. So she started reading those things, and she was not looking at the pictures at all. And later on she stopped total comprehension of what was going on the TV as well. She used to read and write early without comprehension, but later on she forgot reading and writing, and of course she forgot to perform routines, like I said, a daily course, and how to lock and unlock doors. So if you observe all our doors are not having locks, especially the bathroom and toilets, because it has happened a couple of times earlier. She was locked from inside and she wouldn't know how to open it. So we had to break open the thing from the window. So slowly then she forgot how to walk. She used to get up and collapse. She wouldn't know that after putting the left foot forward, she had to put the right foot forward. She forgot. So she used to put the left foot forward and then try to move forward. So I think all this is a product of forgetfulness. Because as I told you, she didn't have any medical problems except towards the later stage she has BP. So walk, sitting and standing, she forgot. And towards the very end, last 3 months or 4 months, she forgot how to chew and swallow. So if you put something in her mouth, she used to keep it in her mouth for half an hour or 10 minutes or 15 minutes. She forgot that she had to chew it. And then later on, even with liquids, towards the very end, she forgot that she had to swallow water or milk, whatever it is. So just used to keep it there. And what happened was, when it happens with water, when the water doesn't get into the gullet, it started seeping to the lungs. And she had a couple of episodes of pneumonia, and that was another issue. So, and it also resulted in pressure ulcers. So if she used to keep her foot like this for 5 minutes, then she used to have
Boils.
Yes, boils. Yeah, and if she scratched her one foot with the other foot, then the skin used to come off. Yes, skin used to peel out. So I realized then that they are called as pressure ulcers. And then, like I told you, because of the water, she used to have congestion in the lungs. So our lungs had to be cleaned periodically. So to go back, since this disease doesn't have any cure, we had to give her palliative care throughout, right from the beginning. And as I discussed with you, the doors and windows, or the doors in fact, we labeled them so it made it easy for them to identify. which one, especially because we wanted her to use the Western commode, because with the Indian commode which she was used to earlier, she wouldn't know how to get up. Of course, even this was in the initial stages. And then some things to do were based on the walls. And then we used to show her past things, that is her photo albums. She used to recollect. What? She used to recollect her parents. She used to recollect her
Past memory.
Core memories.
yes,
Core
but she couldn't tell
The recent one.
she couldn't identify her grandson, right? Because that's probably fairly recent memory. So, and when we showed Sai Baba's photo, then she used to recollect something there, because she was an ardent devotee of Sai Baba. And then these are some of her things that she made using bead making and doll making. So there used to be some sort of memory stimulation, memory recall. And this is the embroidery items which she used to teach, take classes. So all these were aids to try to keep her memory going for as long as possible. And this is of course again in the initial stages. This is at a place called Chitravana, where she tried playing badminton. And then we used to do a lot of exercises. Nowadays, of course, now that my father is also going to a similar stage, this is called a Jenga, or the building blocks.
Yes.
And then this is the laser pen. So you shine the laser pen on the table or on the wall, then it creates some graphics. My mother used to go and try to catch hold of them. My father is, of course, knows that it's not real. And then word building. And like I showed you her handwriting in the beginning, and this was my mother's handwriting towards the latest or the middle stages. This is about 3 to 4 years back. She kept on repeating herself even while writing. We used to, depending on the nurse, they used to give her bangles to draw some figures and so on. This was sort of images which we used to project on the window, on the walls. So my mother was thrilled with this at that time. So my father is doing this now. So he is now busy as an engineer. Once an engineer, always an engineer. Keeps building blocks. Then we realized that their sense of, especially my mother's sense of sight, sense of hearing was going away. So what was left was only the sense of touch or feeling. So it was very convenient for us to make my father sit next to my mother and ask him to hold hands. And he used to hold for hours together without any problem, and probably there was a sense of relief. They were married for 70 years.
Wow.
Right. I'm 63. And daily they go for walks, like you just saw my father doing it. So both of them used to go for walks. That's inside the house, that's just outside the built up area. So, like I told, both of them started forgetting words, understanding, forgetting reading and writing, and wandering. And they started to wander. Towards the end stage, that is the last 3 to 6 months, I did mention that my mother forgot how to swallow and water in the lung with pneumonia, and there was a drop in BP also often. My father started now getting fainting episodes. So when there was a drop in BP, her body, my mother's body used to get cold. So we used to rejuvenate her with glucose or ORS and salt or sugar or whatever it is. So after a few episodes, then this is the pressure ulcer that I mentioned about on the left side, on the bottom left. Her because just she used to keep one foot on top of the other, she used to get pressure ulcers like this. And then she, her hand muscles used to, getting, they got stiff. So we tried, thanks to a family doctor, we tried using hand socks and all that. And since she had problem with congestion in the lungs, she was not able to breathe, and this was, I think, a few days before her death. She was trying to breathe through her mouth. So there is her upper gastrointestinal bleeding, black color, coffee beans colored output, vomiting or stools, pressure ulcers, fainting. And on 7, she forgot how to breathe also. That's also forgetfulness. She forget how to breathe. They asked her one final time and she left her body. So hopefully she has reached her destination and she is a lot more peaceful now. And a couple of, I did a course called Understanding Dementia from the University of Tasmania in Australia. So I think as a caregiver, caretaker, it's better that we educate ourselves on that. Also, some sort of authentication or power of attorney is essential. So either you approach a lawyer and get a power of attorney, or you approach a doctor and ensure that his or her fingerprints are good enough to authenticate the financial dealings.
Access.
So, caregiver tips, yes, we need to be with the flow. There's no point in arguing with the patient. So if the patient says, at midnight, if she says that I have to go and catch the train, then there's no point in arguing. You say, okay, I'll take you to Bangalore tomorrow morning, it is night. So I will also come with you. I will drop you there. So we'll take rest. Now you see that it's totally dark and we cannot go now. So there's no point in arguing, why do you need to go to Bangalore? And so ask, never command, distract, never shame. How many times, you don't know how to wear a sari, or how many times do I have to tell you about the time? Not done. And there's no logic there. Since there is no flow of thought, there is no logic, so we cannot discuss with the patient in terms of logic. We need not lecture, or we can say, even if she asks for the time 10 times, we have to say, or you have to change the topic, you have to divert the topic. Never ask her to remember anything, because she would never be able to remember anything. So, idyar gotta, naan gottilva ninge. That will put her in more confusion. And especially for the nurses, this is what I say: sleep when the patient sleeps, and get up when the patient gets up. You have to follow the routine of the patient, and there has to be a sort of a bonding, because the bonding will always be there. You change the nurse, and the patient gets into some sort of a confusion. It happens every now and then, because no nurse will be there forever. Some of them will be there for a few days, and some of them will be there for a few months. So we try to retain the nurse as much as possible, because whatever it is, there's a bonding developed. The feeling of the touch of the hand, or the feeling of the voice. So you have to adjust with the patient. Be compassionate, be empathetic, go with the flow. Use and music is very important. Especially if like my mother always recognized the Sai Baba bhajans. So we used to put the recordings of the bhajans. So she used to be sitting there peacefully, and same I'm doing with my father now. So group activities, folding laundry. I mean, this is the beginning stage. Now, of course, maybe I can ask my father to fold some laundry. But, okay. And we have a pet, so the pet sort of gives some sort of a some sort of a relaxation. Otherwise, massage and touch should do a lot of this thing. Prevention is the only cure. A few tips on prevention. Prevention. Not talking about the patient, not talking about the caregiver. So as a prevention, now I am very concerned that I should not get dementia or Alzheimer's or whatever you call it, because both my parents have had it. So now it's for me and for others who don't have it, because once you get it, there is no cure, at least not here. So have a good sleep and physical exercise, walking. Try walking backwards, because it sort of stimulates your brain, and exposure to sunlight, absolutely necessary. And socializing, don't be alone, be with friends, go and meet friends, join some organizations. I'm a member of the Rotary Club, I'm the vice president there. So be with family, friends, relatives, children, do some social work. That will give you a lot of calmness in the brain. Act your habits. If you're good at gardening, do gardening. If you're good at painting, do it. And practice the habit of giving. It gives you a lot of self-satisfaction. And some games like chess, learning new things, exercising the brain, Sudoku, crossword, all this comes start of my food every day. And food, try to take some dry fruits, nuts, almonds, and dark chocolate. These are some of the foods, supplements that I take on a daily basis. This is called as Avipatika Churna. This is supposed to be good for the brain. Amla is of course good for the body itself. Ashwagandha Rasayana again is supposed to be good for the brain. Brahma Rasayana for the brain and other things, and then Chyawanprash. Some of the supplements that I take. And reduce passive activities. If you are watching TV, then you are only watching it. At least if you are working on a computer, there is some interaction. So try to reduce TV and check your hearing. Make sure that your hearing is all right. Because if your hearing is not all right, you will not be able to participate in the society. Take good nutrition, listen to good music, and take lots and lots of water. 4 to 5 liters of water every day. Thank you so much.
Thank you so much, sir. That was wonderful. The management of the disease, once Mama, she developed this condition only, did you do some research on managing this disease, or you had to go for a proper counseling or a consultation to design a management plan, or how did it happen, so the process of management?
Neither did we have any idea, nor any of the doctors who we consulted had any idea.
Okay.
Like I said, they gave some medication, which was probably short-term solution, but there is no medication for this. So I think we learned more from experience.
Yes, sir. So you think there should be, more concentration given towards the management of the condition rather than treating it or trying to cure it.
Palliative.
Yes. What are your concerns, sir, as being a caregiver and son yourself? What do you think should be the next steps in the clinical field to approach this disease? What would be wonderful? The ideas that you want to give to young minds.
I heard that there are one or two medicines on the way, or but I'm not sure whether they are already in, whether there is a cure for Alzheimer's. I don't think so at this point.
Yeah.
On the other hand, there are a lot of grandmother medicines available.
Right.
For example,
Coconut oil.
compressed coconut oil, virgin coconut oil. Now, I use it.
Yeah.
I do not know, but it has not caused me any harm.
Right. Last year there were few discussions that they were planning to implant a chip in order to
Inside the brain.
revive the brain functioning. So likewise there are other advances also they are trying to make with respect to CRISPR technology as well, where they'll
What
generally
technology?
CRISPR. That's
CRISPR
when,
gene editing.
yeah. So it's a gene editing thing that they're trying to bring that kind of treatment even in
My
oncology.
son is a student of biotechnology.
Biotechnology. Hello, hi. So they're planning to do with all these disorders that originally originate because of default genes. So you think now when it comes to gene modification, there's a lot of ethical issues coming up because we are basically working with a person's genome, which with editing can cause later greater chaos. So you as a caregiver or as an individual, would you vote for a future in gene editing and CRISPR technology?
Absolutely. You want me to use as a guinea pig? Please go ahead.
There's a saying, no sir. There's a saying that if you use
No,
CRISPR
I
technology,
meant it in a positive sense.
yes. When I
I'm willing
asked,
to submit myself for any experimentation.
that's wonderful, sir.
Really great,
Because
sir.
I don't want to be.
It is very concerning.
We don't have any words to speak now, sir. Really, sir.
Actually, we were so carried away with.
So many things, and the time they get interpreted with us, no, sir.
You want to continue?
No,
Recording?
you
It's okay,
talk,
We
sir.
can have a normal.
Okay, see, you did the test, you conducted the test the other day where I got 29 out of 30. Or
Yes.
19?
Yeah, 29 out of 30.
29 out of 30, great. Now, I normally do very well in the test.
Yes, sir.
When I know that I am being tested,
Yes, sir.
I do well.
Okay. And more when we saw, when we were taking the test, no, sir, we were a bit nervous, like, okay, now test is going on,
That
test
is
is going on,
natural
it's
because-
natural. But you stressed yourself, sir. That made you come little bit 1 mark less, or else you have scored 30 out of 30, sir. Seriously.
No, it has happened not just now, it has happened throughout my life. When I was working with Excel Talk,
Yes, sir.
I am not a software engineer by education. I did my BE in civil. So, but Excelsoft conducted an internal test for its employees, a technical test, and I topped the test.
Wow.
Wherein the group had so many computer science engineers. So the point I am trying to make is, when I know that I am being tested, I do very well. But otherwise, I'll forget my key, I'll forget my helmet, I'll forget to, nowadays of course I used to be a very good mask wearer, but I stopped wearing mask. So I'll forget wearing mask. So sometimes I wonder,
And
Whether
that
I'm
you
in
said,
trouble.
and that you said you will make a keynote of a day, like if you go for a program or if you want to give any speech,
absolutely.
you will make a keynote. Like wow, like how do you do the keynote, sir? Like, can we see once?
No. This is of course about this one.
This one,
Okay.
okay.
Because for your program the other day, just in case,
Yes, sir.
Okay.
I take the worst possible scenario. Just in case there is no power or my computer does not work or something, at least I should be able to give you a 10-minute talk. So I just wrote down the point. These are called as keywords.
Yes, sir.
So that is enough, since you know the subject,
Yeah.
this is more than enough for you to talk for 10
Talk
minutes.
on,
Yes.
right.
That's, I think, that's commonplace.
Other than you're engineers, you're a good teacher, sir. Be frank.
Really, sir.
Really, you're a good teacher, sir.
Thank you,
Seriously.
thank you.
I think
We are a family of teachers in the sense from my mother's side.
Okay.
My grandfather used to stay here, was head of the JSS group of institutions and he was inspector of schools. My grandfather.
You're kind of for that one, sir.
And then his son, my uncle, he was an engineering teacher. He's in Coimbatore.
Wow.
He also speaks very well.
as we all saw today, Arun Belawadi sir was extremely patient and he took us through the journey of management of Alzheimer's disease, and we are extremely grateful to sir for being so kind enough to, you know, walk us through the house and share his memories and experience with dealing with Alzheimer's patients. So the takeaway message that we learned from sir is, it's, you know, it's never too late to begin again from the start, and all that takes is compassion and empathy to treat the patients right. And thank you so much, sir, for giving us your valuable time and explaining us the severity and seriousness of dealing with this disease. And we are hoping to work with you more and more in the coming future.
I'm hoping to work with you as well.
Yes, sir.
Because I feel I have something to offer.
Yes, sir.
Whether it be for a caregiver or whether it be even for some of the trainees,
Yes.
having gained a lot of theoretical and practical.
Yes, sir.
Thank you, sir.
Thank you so much, sir.
Thank you so
Thank you.
much, sir.